Welcome back to Our Issues Milwaukee. I'm your host, Andrea Williams. As we wrap up today's show, wanted to take a moment to shed some light on a subject that we're hearing more and more about: trauma. Several weeks ago, Oprah Winfrey traveled back to Milwaukee, a place where she spent part of her childhood, to discuss the epidemic of childhood trauma on 60 Minutes. She talked about the importance of changing the way our society works with children who have significant behavioral issues. My final guest is Dr. Robert Fox. He's a consultant psychologist for the Behavior Clinic at Penfield Children's Center, and he's also a professor of psychology at Marquette University. How are you, doctor?
I'm good. Nice. Thanks for inviting me.
Thank you for being here. And if you would, right off the top, tell us more about the Behavior Clinic that you helped found at Penfield Children's Center.
Yeah, I'd be happy to. We founded it in 2003, so we're in our 15th year. And the primary focus was to provide mental health services for children under 5 years of age who lived in poverty and had significant mental health issues. Because up until then, there really was no places for those parents to take those kids.
Wow, and just even saying that you're dealing with children under the age of 5 who deal with traumatic experiences, that automatically leads me to asking you, like, what are some of the things that are considered traumatic for children that young?
Well, historically, it was the big four. It was things like child abuse, you know, and neglect and emotional abuse and sexual abuse, but it's gone much broader than that.
Okay.
Now, domestic violence, just witnessing parents fighting, living in an unsafe neighborhood where there might be drive-by shootings, going to the hospital. It's any event that triggers a pretty distressful response in the child can actually be called a traumatic event.
That makes a lot of sense.
It's pretty wide.
So I guess as a psychologist, how do you go about detecting that there is trauma there for a child in that age range?
Well, you do two things. Because they're so young, you're not going to interview them much.
Right,
you talk to their primary caregiver, and that may be a biological mom and maybe a foster parent. And you ask about some very specific questions. Has your child experienced any of these events? And then the second thing you do is you start looking for symptoms in the child. So behavior problems really top the list because these children don't have good self-control. And then you look at other things like maybe nightmares, or maybe the child was toilet trained and now they started to wet themselves, or staring off into space. So there's a lot of little symptoms that young children already display, where historically people didn't think that they could experience trauma. Today we know that's not true.
Yeah, and it's certain things that children would do, and you would hear the term, oh, they'll grow out of it, right?
Yeah, well, that was the common response, and actually that was kind of accurate for a bunch of kids. But if you're living in poverty and you have a significant behavior problem and you don't get an intervention, chances are you're going to keep those issues when you enter school.
Yeah, and that's one of the things that Oprah Winfrey had said: we as a society need to stop asking what's wrong with you, but more of what happened to you. And I felt that that was powerful, because we've had this conversation about trauma on this show many times, but when you have somebody like Oprah who brings it to the forefront, the masses have a tendency to listen to what she's talking about and becoming more aware.
Well, you know, I've been in this field for 40 years, and I don't remember a topic such as trauma capturing not only the mental health field, but across the board. And when you see people like Oprah and you on this show bringing awareness, that's really the first step.
I love it. So what I would like for you to do is inform the viewers how, in fact, they could get a child that they have with them or someone they know to get involved with the Behavior Clinic. Is this something that you go by? Do they have to be referred, or can they just give you a call?
No, they can give us a call. They need to live in Milwaukee County right now, because we can't serve much more than that. We have a long waiting list. But if they call Penfield Children's Center at 414-344-7676, that gets the ball rolling. And then we do all our services are in the home of the family, so we don't ask them to come into the clinic. We go there. So a lot of the barriers, such as transportation and childcare, we erase by going out.
That's amazing, and it really is important to recognize the scenarios that people are dealing with on a daily basis in order to get their child help. You're making it easy by going to them. Doesn't get better than that.
Yeah, I agree.
And so there's an ACE test, and that is pretty much stands for Adverse Childhood Experiences, and you really have a rating for your young patients. Explain that.
Yeah, well, we actually started with the ACE and developed our own scale called the Preschool Inventory of Trauma Symptoms. So we can now detect from parent report a child as young as 1 year of age who's experienced trauma and has trauma symptoms. The ACEs was developed more for adults originally and what kind of experiences they had. Now we're able to tailor that down to very young children and catch it before it becomes a serious problem for them.
Very interesting. So statistics do show us that young people who experience trauma are 5 times more likely to be depressed, and there's a higher rate of mental health issues as well. So all of these are, you know, things that we need to keep in mind and make sure we pay attention to not only just young children but teenagers and individuals to make sure we are really doing all that we can to help them.
Yeah, and if you look at national statistics, the number of kids who are abused, the highest number is 3 years of age or younger.
Wow, so it really...
So we really are missing it if we don't start early on.
Okay, so what you did talk about some of the things that children may do if they have experienced trauma. So is there something specific that you can say to a parent who might notice something off? What are some of the things they will look for?
The first thing we ask parents to do is be observant, watch your children, and if it gets to the point where their behavior is so out of control that you feel like you can't handle it on your own, you do need to seek professional help. And if you recognize that and get that help early, we can turn things around quicker than if you wait until the child gets older.
Yeah, that makes a lot of sense. So is there anything else that you'd like to share with us today?
Well, I think the last thing is there's relatively few professionals that can deal with this younger population. And we could look at university programs who train people. They still haven't taken it down to the very young age. So if you want to be a psychologist and work with little kids, you're going to have a hard time finding training programs to do that. So my hope is that we'll get more people that can provide services.
Okay, so I thank you for coming by, and like I said, this is a very important subject because a lot of times we look at the news and we do say what's wrong with this person or that person, but really sometimes the issues are a lot deeper, and it's people like you who are helping make a difference in dealing with those issues. So appreciate your time.
Thank you,
and thank you for all that you do. Dr. Robert Fox is the consultant psychologist for the Behavior Clinic at Penfield Children's Center, and he's also a professor of psychology at Marquette University. For more information, you can visit penfieldchildren.org or call 344-7676. That is going to do it for today's show. I'm your host, Andrea Williams. As always, I thank you for watching, and I hope you join us again next week as we take another look at our issues in Milwaukee. Have a great day.